Hey guys, there was some confusion about the mask rotation part of the protocol, so I just wanted to make a quick video to make sure that we're all on the same page and we're all doing the right thing. So there's two parts to it. One is for when you go for therapists who go to our assisted living facility, and the other one is for when therapists go to people's homes. So for both of them, you're gonna need 2 paperbacks for each of the days that you go to see patients. And the first one is you're gonna write the day of the week and unused, and the other one is day of the week and used. So let's start with the going to people's homes part of it. So think about how many patients you have for that day, and that's how many N95 masks you're gonna need. So say today is Thursday and you're seeing 3 patients. This is your Thursday bag and three N95 masks. So start your day with all of them in the unused bag. Get to a patient's home. Put on your first mask. See the patient. When you leave the home, obviously perform hand hygiene, and then place the mask carefully into the used bag. Get to the next patient and repeat the process. Now, moving over to when you're seeing patients in the assisted living facility, when you're in the building, you need to be wearing an N95 mask at all times, in the hallways, in the elevator, always. Don't get caught without it because one time I took it off for like literally 2 seconds to fix it, and somebody from the management saw me in that very moment and made a remark to me. So don't do it. So you're gonna need one at all times. And then think about how many patients you're seeing, and that's how many surgical masks you're gonna need for the day. So again, put them all in the unused bag, get to the facility, come out of your car or in the car, put the N95 on, go to the building, sign in, get to the patient's door, perform hand hygiene, and then put on a surgical mask over the N95. When you're done seeing the patient and you leave the room, take the surgical mask off, put it into the used container, paper bag, not container, paper bag. Continue wearing your N95, get to the next patient, take the unused, put it on, and keep going. And obviously when you're done, take the N95 off and put it into the used paper bag. And that's about it. It's a lot easier when you explain it than when you write it on paper. One quick note about storing them. Make sure you keep them in these paper bags, and that the paper bags themselves are not inside another plastic bag, because they need to breathe, otherwise they can breed bacteria. And obviously keep them away from pets and kids. Again, trust me, I would know. Another quick note, please make sure to do the patient screenings. I know they can get a bit kind of awkward and annoying. There are just 2 quick parts to it. One is exposure and the other one is symptoms. So just ask those 2 quick questions, and always preface it by saying it's just vital for everyone's well-being and health. And another one last quick note, just a little hint that I've learned for when you wear your N95 and your face gets all wet after a few hours. A quick way to keep your face dry is to use a regular tissue and to fold it in a couple of times, or maybe 3 times, in a way that it's small enough to fit right over your mouth and your nose, right under your nose. And then you put it inside the mask, like so. And then it keeps your face dry because it absorbs all the moisture from your mouth and your nose. And if it gets wet, if you feel like it's getting stuck to your mouth, then just take it out and put a new one. All right, that's about it for today. If you like the video, give it a thumbs up. Just kidding.